of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The next order of business is just to make sure, Mr. Houle, no letters to be read?
No.
No letters to be
I've
read?
received none before I came up here.
Okay. Number 2 on the agenda, obviously the only thing on the agenda is extension of the Crow Wing County declaration of a local emergency. Do you want to, Mr. Houle, just to let everybody know, that the chair by statute can call a local emergency, and it's good for 3 days,
Correct.
if I'm correct?
Yep.
And then the board has to, would it be ratify or?
Yeah, extend, ratify.
Okay. So I don't know if I should say I refused, but I said I thought this was a bigger decision that it needed to be left up to the entire county board, and so thus that's why we're here today.
Right.
And so I guess I, as one member of the board, I'd like to have an explanation of why you think that we need to extend this. I will say that for my part, I think we've done a lot of stuff already. I mentioned this before. I think we've purchased 30,000 masks. I think we've got plenty of personal protective equipment. We've spent thousands and thousands of dollars on these sneeze guards, or whatever you'd call them. I think people know what those are, because if you go to any store, I think a lot of them put them up. We bought a reefer trailer. That's all I can think of off the top of my head. I'm just wondering, what else do we need to do, or to have this emergency? What else would we need to prepare for, I guess? And what would be your reasoning for wanting to extend this?
Mr. Chair, members of the board, I think there's 3 things that come to my mind, and one of them is the purchasing authority. You know that the bid law confines us a bit. And so I think our efforts to try to buy local, just for the normal course of county government, that gets suspended when we have to go back to going through bid processes. So we would not be able to continue that focus. The second thing is the speed with which we can acquire PPE. We would need to go out for bids. And in the current environment for PPE, that will slow it down, and the likelihood is we may not be able to acquire it as rapidly as we may need to moving forward. We are in a pretty good place, to the chairman's point. We are in a pretty good place as it relates to PPE right now. We don't know how things are going to change. So those are the 2 things I think on purchasing that stand out. The other one is...
If I can just stop you right there, anything else that you can think of right off the top of your head, not to put you on the spot, but is there anything else that you think that at this moment we need to purchase without going out for bids, I guess? Any emergency thing?
The one thing that has occurred to me is our efforts to try to get the local community open. As a government agency, we may be able to be a conduit for PPE, for private business that needs that kind of equipment to help them reopen. And so I am thinking about hair salons or barber shops or the like. Their capacity to acquire PPE in the current environment is going to be quite challenging. And so that's the one thing that occurred to me, that in our efforts to try to help the community to reopen and to do so safely, that's the one thing that occurred to me.
So maybe an explanation of PPE. What would, just so people can understand what we're talking about.
Sure. PPE stands for personal protective equipment. And so in this regard, as it relates to the community, I think it primarily would be around face masks, that the better quality that we can get, the safer people are, and primarily like latex gloves. I think those are the two things. They may, in some instances, need face shields. I don't think they're going to need surgical gowns or the like. I think that's probably further than what they need. So I think it's primarily gloves and face masks.
Mr. Chair, too, I just kind of going over that emergency management call, I think that probably John put together too, is that, having the PPEs available, and we're saying daycares are in need of these. So, I mean, can we get the public to look for the county as a resource for these PPEs?
That is what I think we have the authority to do under the emergency declaration. I don't think we have the authority without that to be a conduit to sell things to the private sector, because there would be this disposition of public assets process that we have to go through. We have to either go through sealed bids, or we have to go through an online auction site. And so it does provide those flexibilities. But that's a choice. That's up to you guys.
So when you say providing this as we start to open up, providing this material or this PPE, so we're not selling it, so we're buying it and spending the taxpayer dollars and then we're giving it to businesses?
I wouldn't suggest that, Mr. Chairman. I would suggest that the business needs to cover the cost of the PPE, but I think we have access to supply chains that they will not have access to. We will have access to quantities that they will not have access to. And so what I see is the potential for us to acquire, and they cover the cost. So it's almost like a pass-through. Under normal circumstances, we can't take public assets and just pass them through like that.
What else? Why don't you continue on? What other reasoning would there be to extend this?
The other thing that our resolution covered was the county board meetings and continuing to have the pandemic and trying to avoid having crowds appear at our meetings. We don't really want crowds of any kind in the community, whether that's, a music festival or whatever other kinds of gatherings. So the limitations that we have in the resolution on your county board meetings, I would suggest that it's probably wise for us to continue to do that. And the third thing is the county government, and this is the least important one, I think, because we're very close. We're anticipating the governor's stay-at-home order we don't know whether the governor's stay-at-home order will expire on May 4th or not. We're operating under the presumption that it will expire, and our intention is to try to open county government offices back to the public, and we have been spending that interim time trying to create safe environments. And so, Mr. Chairman, you referred to the sneeze guards. It's essentially glass that separates the people who are waiting on the public from the public. That's not for just one or the other's protection. It's for both protection. We're pretty close to ready to do that, but I believe because this resolution that you passed authorizes that, letting the resolution expire, what I believe that I would need to interpret that as is the county board's desire to have that occur tomorrow, that the building is unlocked tomorrow. We're really close to being able to do that. We had planned around May 4th, and so I think there's about a 1-week difference in there. If you pass this resolution, any resolution today that continues a local emergency, it will only last for 30 days. And so we'll have to be back at this every 30 days for your reconsideration. So that's the smallest.
When does the first one, I don't see the date. When did the first one was enacted when?
Your declaration was on March 21st. That was a Friday.
Okay.
And then the county board came and ratified and extended it on March 24th.
So then tomorrow would be the end?
Is today the 23rd?
Yes.
23rd.
It expires today at midnight.
Okay, and so what this does, it doesn't really say when it ends, but it's for 30 days?
We put in the resolution that it expires at the end of the peacetime emergency, And so the way I would phrase it to you is by law, it expires within 30 days. The way we've written it, if the peacetime emergency expires sooner, then this would expire sooner than 30 days. But we have to be back here at least every 30 days to reconsider.
You know,
Mr. Chair,
Go
can I-
ahead,
just a
Commissioner.
question. If we have this declaration in place, is there any way that we can be more aggressive in going for testing? Because that seems to be such a big issue in regards to, we have to have so much, and I know the state's coming out and saying they're going to be so aggressive, but my fear would be is to be more focused on metropolitan areas than Crow Wing County. Can we push for that if we're under a declaration?
Mr. Hool.
Commissioner Brecken, it's a really good question, and I'm not sure we have a great answer for you today. The governor announced, I think it was just yesterday, that partnership with Mayo and the University of Minnesota to more aggressively test, one, for COVID, and then two, for the antibodies related to COVID. That would be testing to see if somebody has had it and recovered. I'm going to turn to Michelle, if I can. Michelle Moritz is our public health supervisor. She may have better information from the Department of Health. That's what I know as of today.
Good morning.
We pull the mic down, Michelle.
Good morning,
thanks.
Board Chair. Great question, Bill. As far as the declaration, I too don't necessarily have an answer if we would require the declaration to be able to do what the governor is suggesting that we move forward with. Currently, the state is doing about 1,000 tests a day. We have a long ways to go between 1,000 and 20,000 that they're suggesting that is our goal to get to. And this first phase is ramping up and getting our hospitals and clinics and other alternative locations ready to be doing those testing, and I certainly hope public health is part of that. There was much discussion about that yesterday, if you saw at the governor's conference, but then following, we had a conference call with the Commissioner of Health and the representatives and leaders of the infectious disease portion of MDH, and local public health is very much interested in being a big part of that testing, and I certainly am as well.
Michelle, what kind of testing have we been doing so far in the county?
So within the hospital and healthcare systems, the clinics, they are doing swab testing to test to see if they're positive right now for COVID, so active disease. What they're also suggesting that we work towards, and we have very limited at this point in the state, is that serology testing to see if people have antibodies to the virus, and that's what I believe is what's going to get us back to work, is knowing if people have had how widely spread has this disease been. With the testing that we're currently doing with the swabs looking for positive tests, as of yesterday, that drastically changed. It had been limited just to healthcare, and then also people that lived in congregate care settings, and then people that were hospitalized. So that's a very small number in comparison to our greater public that may be showing symptoms. It's a small number. Now, as of yesterday, the governor is suggesting that anybody that has symptoms that looks like COVID should be able to get tested. It's been a matter of our hospitals and clinics not having the different agents that they need, the swabs that they need, and that's part of this pre-phase of getting the tests where they need to be, getting the agents where they need to be. So it's like they have part A, but they don't have part B, and so they can't move forward. So we need to get these parts together and get these tests done. So we know, because at this point, we don't believe that we're anywhere near the peak of disease. We are only hearing about a little bit, and I know, thinking back to flu season, when our kids were in school and the long-term care facilities, we would hear that there's an outbreak at this location or that location, the school or a classroom, and right now we're not hearing of great mass numbers of people sick within our community. There's definitely illness. I mean, they're definitely doing, 1,000 tests is a good number still, but we are not there where we're suspected that we would be at our peak.
Michelle, before you step away, I just want to tell you a story. I don't know about everybody else, but I keep hearing from people, and I think that I feel like people are starting to push back against this, and I think we all know that. I talked to a good friend of mine, she works at a bank, and she says, I think my husband and I have already had it. And I said, well, what do you mean you've already had it? She says, my daughter, as you know, and her husband and our grandkids live in New York City. They went to New York City in February, and when they got home, they were sick, really sick, upper respiratory, a pneumonia type thing. Both of them were off work for a week, and they were sicker than a dog, but they're back to work. You know, I don't know.
I have a
If
very
I don't know
similar
if they had
story.
it or not. They might have had it. And so I'm just wondering, this thing is gonna have to, you know, here, come from a farm boy that doesn't know anything about this, but I just think it's gonna have to work its way through. You know, this notion that we can keep things locked down and prevent it, I don't know that that's gonna happen. I mean,
I have a very similar story, and that's where getting tested and having the opportunity to be tested would probably help reduce that fear also for individuals. If I knew that I already had antibodies, that would reduce that fear of contracting it again or contracting it for the first place. And I know that many people have told me that same story. I was so sick in November, December, January, February, but some people in our community have had the opportunity to have these tests done, and shockingly, it came back that it was negative. It was gravely different, their tone from before when they thought they already had it to their tone when they got the test results that said that they hadn't.
okay.
They weren't as confident as they were the prior day even. I would be more confident if I knew that I had already had it.
Sure. Okay. Any questions for Michelle from the county board? No, thanks.
Thank you.
Mr. Chair, from a
Mr. Rule.
finance perspective, the only thing I would add to that is, right now, what we're hearing is that the federal government is providing resources to make sure that that testing would be free. And I presume that would mean free to us. I think we're going to know a lot more about that within 30 days, but right now, that's what I hear. Since it's not happening yet on the ground, what does that mean? I get fearful at this point because the federal government is trying to provide resources, but there will be so many people that are trying to get those resources at the same time. I'm hoping it will be free, but I don't know that. So that finance concerns me a little bit, too.
Well, I guess I'm just concerned that people cannot come up to these meetings. I mean, this is their government, and we're barring them from, in essence, participating in their government, and that concerns me. It concerns me that people can't get into the building to conduct business that they need to conduct. And I don't know how long this can go on. Obviously, I'm not an expert, I don't know, but I just know that I'm getting quite concerned that I think that people eventually, if this goes on for much longer, people are just gonna not listen to their government. It's a concern.
Mr. Chair.
You know, I mean, I was reading, I've been trying to read as much as I can. I don't know if you've watched Washington State, but there is a sheriff, Sheriff Goddard, there is a sheriff in Washington State who is not enforcing the governor's orders to place people under arrest that are not abiding by the quarantine. So, I don't know. I'm giving you food for thought in that I'm just expressing what I'm hearing out there from different people. If you look at our Facebook page, there's a couple of comments, and one of the comments is, "Get government open," or "Get us open." So, anyway, Commissioner.
Yes. You know, even in my district, I know there's a couple businesses that are already talking about they're just going to open.
Yeah.
You know, so that there is that movement that's going on. If I can ask Mr. Hull a question here in regards to, is really kind of the issue here that we're a week lag in regards to the May 4th and what, because if the governor lifts the stay at home, that kind of opens up for everybody, doesn't it?
It doesn't necessarily. There's two different things going on. One is the stay-at-home order, which is really telling people try to work from home as much as you can and try not to leave your home as much as you can. That is not the same as the executive orders that have closed certain businesses. And until that executive order is lifted, restaurants and bars can't reopen. Even if the stay-at-home order expires, the executive order has not expired. To your point, Mr. Chairman, I think that's important, and I think you're probably all hearing that as well, that
Oh, for
people
sure.
are getting very anxious about the economic impacts, which is why we're trying to pivot county government as best we can to saying, what role can we play? And this goes back to the conversation that, Mr. Chairman and Commissioner Brecken, you kind of directed us around. How can we help the private sector to reopen and to do it safely? Unlocking the door won't solve this problem because there's going to be too many people who are still afraid and they won't come. And so it's this combination of unlock the door and do it with safety. And to Michelle's point, having some testing and more testing capacity in our community helps to reduce that anxiety. Having PPE available readily in our community for our business community reduces that anxiety. The surest way we can get ourselves back to whatever new normal this is to reopen with safety. It's not either or, it's both. And so we are trying to work very closely with the Chamber of Commerce to convene industry by industry these conversations with salons, with barbershops. What are you planning to do? And we're hoping, because we don't think safety is a competitive advantage, we hope that hair salons will share with each other. Well, here's my idea, here's my idea, here's my idea. We want to try to facilitate that and be part of the solution as much as we can.
One other thing is, I know that you had a conversation with the grocers, but yesterday they were interviewing a guy, and this was on the East Coast, because of there could be a disruption in the food chain, is what they're saying now. And so as they were interviewing this guy that's in charge of this supermarket, there's people behind him shopping, and there's a big pile of apples, but people are touching that stuff, that food, and I don't know about you, but I look at an apple and looking to see if it's okay, and if it's not, I put it back. I haven't been doing that, obviously, lately, but this notion that we've got everything in line, that there's not going to be some kind of a contamination there it was right there, so anyway.
It's sort of like
I'm just skeptical. I'm trying to be, I always think of Mary Cope. She always used to say, let me be the devil's advocate. And I'd always say, do you have to be? And God love Mary, but she'd always give you the other side. I just think that it's my job to come here and not just say, oh, yes, this is a great idea, Mr. Houle. I think I need to ask questions of why this is, and honestly, I just am not convinced that we need to extend this, so. Commissioner Brecken?
Yeah, Mr. Chair. One thing I want to point out, at least for the commissioners, is that I think that we've really taken a leadership role within our community on this. We have been proactive in regards to the property waiver, tax waiver that we've looked at. We've been taking an effort to protect the staff in the county community, working within the county, so when we do reopen, we're ready for that and make it safe for them. We have been working closely with the Brainerd Chamber of Commerce and the Brainerd Lakes Area Economic Development Corporation and getting that feedback and being a partner with them, so I think we've been going with that. We have been talking to businesses about best practices, so I think we really have been key in the role as we're moving forward with this. And I want to see us reopen. I see that too. And it's like, how do we do this safely? I think the Chamber has done a petition. I think last I saw was at like 2,300 signatures. They want to get up to 2,500 to present this also to the governor and saying, we need to do this. Talking to the business and the resorts especially, they need to, one of them, if this is lifted on the 4th, they're going to be open on the 8th. People are just chomping at the bit to do this. So it's a matter of, if we do the resolution, is it possible to do something modified so that we can do that? And also, maybe we have to have some control in there about how we were going to manage costs, if there's some, so that we can make it a balance in there, besides extending it for a period of time with less restrictions or however it is. I think you gave us a couple options. And then maybe we have to look at, this is our second special meeting, but maybe we have to look at how the expense, if there is expenses that come, how we're going to manage those.
Any comment on that, Mr. Houle?
Mr. Chairman, members of the board, I think those are appropriate considerations. And to your point, Mr. Chairman, let's not delude ourselves into thinking that we can eliminate risk for everyone. We cannot. We cannot eliminate the risk of catching this. What we can do is try to protect ourselves as best we can. And the example I would give you is, we've been making automobiles for years and years and years. We've put many, many, many more safety features into those automobiles over the course of time. That has not prevented car accidents. That has not prevented people from becoming injured or worse. It has reduced the numbers. And that really is our target here, is to try to mitigate to the very best of our ability. I do think, that you're interested in having a shorter feedback loop, I think, on what are the costs associated with this and how do we manage that. And so I would welcome whatever ideas you have in that regard. You could think about setting a budget limit before which you got to come back. There should be some reporting feedback loops, and we've started to do that, and we will continue to do that for you. You got one the other day. I'm going to give you notes from each of the calls that staff are having regarding this. And so, to Commissioner Brecken's point, and to your point, Mr. Chairman, we have no reservations about any of those kinds of things. I do understand that you want to make sure that you are managing the crisis and that you're giving direction to staff on how you wish us
Correct.
to do that.
Sheriff Goddard, you had your hand up. Did that mean you wanted to say something?
My partner's with me, and he's just getting kind of back into training yet too. Mr. Chair, Commissioners, I did send an email to Tim, I believe was forwarded off to you. To go back in time, and this is very recent history, 30 days from where we are now in comparison to the past is drastically different. And in my email, I did indicate that we cannot predict any of this. And if we did, we'd be sitting right next to the president answering questions. This is not, in my mind, the messaging we want to send forward. We need to send that we're being proactive in taking steps necessary. I came back from vacation and spent the next 23 days at 16, 18-hour processes inventing the wheel and the book that we wrote and where we're at today. And who I look to for my guidance are sitting behind me, John Bowen and Michelle Moritz. They are the people that we pay to make decisions and to come up with protocols of where we're heading. Working with them, it does seem very basic to me. The messaging going forward needs to be, we need to be proactive. As Michelle mentioned, we have not reached the peak. We don't know where that is. And whatever we can do to ensure our processes will protect everyone, I think is worthwhile. And these are not huge steps. I don't see these as being huge steps at all. You mentioned, Commissioner, you mentioned, or Mr. Chair, you mentioned what we need. I don't know what we need. I don't know if the masks that we have are going to be adequate. I don't know if we're going to need 6 times that. No one knows that answer because we simply don't know what this is going to evolve into. But I'm hearing the same messaging you are, reference to businesses being open. I've got a lot of close friends that own businesses throughout the area, and it's that happy medium. And I see this motion of what's in front of us today is to me as being a non-issue. This is something that should be just part of our playbook that we're taking and making sure we implement.
Okay,
Thank you.
thanks. Commissioner Franzine?
Well, I think that I've been getting calls from people who want businesses opened. And what I have to tell them is that is not what we're doing with this emergency declaration. What we're doing, we're talking about social distancing. We're talking about limiting people in meetings. We're talking about live streaming meetings so that people are able to participate. And we're talking about having people work from home to protect their health. I think we need to make it perfectly clear that we are not shutting down businesses, because that's what people seem to believe is happening with our declarations, and that's not what we're doing. We're just trying to make sure that people are safe, and I would like to see something in here. I mean, it does say, that this remains in effect during the peacetime emergency declaration, but it does not say it expires in 30 days. Is that a state statute that it?
I believe so.
Okay, that's what I wondered, because it isn't written into here, and I would just like to see that written in, because people don't know state statutes unless you look it up. I mean, you can't keep track of all of them. But I want to see businesses open too. I'm afraid that if places are closed much longer, there are many of them that won't be there to open up when this is through. So I'm concerned about that. But our declaration does not close businesses. It's just trying to keep people safe. And I guess that's all I have to say.
Thank you, thank you.
Good.
Anything else from the county board? Commissioner Barros?
Thank you, Mr. Chair. I would agree with Commissioner Franzine that we don't shut down the businesses. That's done through the governor's office, not ours. It's not our authority to do that. I do think that we don't know what the apex of this thing is. I know that what I know is we don't know what we don't know. And so for me, this isn't a great decision. I mean, I don't look at this as something that I want to be part of. None of us, I don't think, ever wished that this would happen. But I think it's the right decision at this time to continue this declaration.
Thank you. Commissioner Hoag, anything?
Well, I agree with Scott. I don't think, it's been 5 weeks, I think, since we've initiated this 4 weeks plus. And back 4 weeks, how many positive cases did we have in the county?
Currently, Crow Wing.
Yeah, 20 today, but 4 weeks ago.
Well, on March 26th, we had 346 total cases, and today, or yesterday, we were at 2,721.
It's statewide. Yeah, but county?
Crow Wing, we had 0.
Okay, so in 30 days, we've gone from 0 to 20. And again, it's the unknown. We don't know where this thing's going. I was on a call last week with some folks from CRMC, which they estimate the peak of this to be out in May sometime. So again, this is not going to do anything about the businesses. As a business owner, I've taken a direct gut punch on this thing, but I'm not ready to open my doors to the public and risk my employees, risk my mother who works there. The health of them is more important than a business at this point, not knowing what's coming at us yet. So I think we need to continue to operate as we are. We're not denying anybody access to government. It's just a different way of doing it today. And no matter what you look at today, it's different than what it was 30 days ago. So I'm just not ready to relax on this. I think there's a lot more to be learned. We heard yesterday that there's going to be a big push on testing, and I think until we learn more about that and actually see some of the results of that, I say we stay the course as to where we are and just make sure that we're protecting the employees and the people of this county. Some will never convince that that's the right thing to do, and I understand that as well. But I think it's the right thing to do.
Anything else, Mr. Hool?
Mr. Chairman, Commissioner Franzine, if you do want to put the 30 days in, you certainly can, and I have some suggestion about how to do that if you're interested. I would also point out that in that paragraph, it says, remain in effect as long as the state of Minnesota peacetime emergency declaration remains in effect. subject to any other limits placed upon such a declaration by state statute. And it is that portion of the sentence that in my mind referred to the 30 days, but I understand the desire for maybe a little bit more clarity than that, so that's up to you guys.
Is there a motion to extend the Crow Wing County local emergency?
Mr. Chair, I move that motion.
Commissioner Barrows moves that motion,
Second.
seconded by Commissioner Hoag. Any further discussion? Hearing none, all in favor of that motion signify by saying aye.
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 Opposed? That motion passes. Is there a motion to adjourn?
Also move.
Motion by Commissioner Brecken,
Second.
seconded by Commissioner Barrows. All in favor of that motion signify by saying aye.
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 Opposed? That motion passes. We are adjourned.